So I will be brief because you've had lots of much more articulate speeches than I can make tonight. But what I just wanted to cover was really two major areas. I think first the immense potential of HIFA and the whole issue of health information. And I was reminded of this just last month when I was on a work trip in a village halfway up a mountain somewhere in western Nepal. And as a photographer, and it's one of the most beautiful countries in the world, I was keen to be, I had my camera with me. As I was taking a picture, into the frame came the wife of the farmer we were meant to be interviewing, and she was photographing me with her mobile phone. And this was just a small reminder to me that particularly in South Asia, I mean, I did think I did see the numbers of hundreds and hundreds of millions of these devices, and increasingly they're all connected to the internet. So the technology is now out there. In other words, we want to, if there is accurate health information, the technology exists to getting it even down to the village level, to the health worker, and even to that woman halfway up a mountain in Nepal. And so the potential is there. The potential is immense. I think the other thing which excites me about HIFA is that although we talked a lot about poverty and issues of healthcare in poor countries, so much of these things are now global issues which affect us all. Issues like antibiotic resistance, issues like this increasingly worrying trend of measles increasing. I mean, of course, poor people suffer most from these things, but they can hit us as well. The world is now very, very small with so many people moving around it. And so that increasingly I would see this as a global issue, not just a matter of sort of us in the north helping people in the global south. So I think the potential is absolutely immense. The other thing that excites me about HIFA, I mean, I've known Neil, I think we started chatting on the Charlbury station platform about 25 years ago when I used to commute. One of the things that has always impressed me about HIFA, which I said in that leaflet, was that it's incredibly efficient. Some of us in this room, I think, have worked at some point for Oxfam or maybe other charities as well. And I think we were always trying to defend our so-called overheads and, you know, the size of the office. And then we got a new office in Cowley, and people sort of raised eyebrows about that. Now, I think before you leave, you might want to do a tour of the HIFA office. It won't take very long. There'll be no charge. And I'm sure Neil will be happy to show you the various stories of the office. But no, I mean, I think it's absolutely extraordinary that we have here in Charlbury something which is run by basically, Claire, I mustn't call you half a staff, but basically in terms of the payroll, just 1.5 staff members, running a campaign which now reaches, we see here, 19,000 members, covering 4 or 5 languages, 300 volunteers. I mean, the statistics are sort of mind-blowing. And it's all here in Charlbury, which is so delightful for us. I mean, I think, I've spent too much of my life rushing around the world, attempting or not really succeeding in sort of either doing good or pursuing my career. And suddenly here, within a few yards of where I live, we have this amazing initiative going on. And so I'm very happy to be a supporter of it. I give a monthly direct debit, and I find that's a painless way of doing it. And I partly do that because, having worked in the charity sector most of my life, I'm well aware that charities, I mean, it's lovely to get the big once-off donation, the legacy, that's fantastic. What charities really need now is, and organisations like HIFA, what we call it, a community enterprise company, they need regular income so that they can actually plan and expand on the basis of it. So that's why I'm here tonight to say that, you know, I value my donation to HIFA. I also support the fundraising group, and we've got an incredible team now working together. It's really a very exciting initiative, and I hope that that you can also join and do the same, because I think it's amazing that we have this initiative being run from Charlbury, and we wish it would be better known. And tonight is the first step in that campaign. Many thanks. Thank you.
Thank you.